because I know you're doing serology now every 3 months, you mentioned. Kind of when you started looking into the different serologies that you could do for cocci, whether that's immunodiffusion, complement fixation, or enzyme immunoassays, do you think there was enough information out there to equip you to do serology, or do you think things could have been clearer? And kind of a patient perspective, how do you kind of talk about that to a patient about the different serologies and why one may work better than the other?
I think that's a good clarification point, because I didn't know exactly what would be the best one to use. So I did the complement fixation, and that was one that I had read that was what to use. But then also the ID doctor, that's what she wanted to use also. So that's kind of why I went that route. But that would be helpful to understand which one would be better usable with this. So I think that could have a little bit more clarification. And then as far as speaking with the patient, explaining why do we have to do this every 3 months? What are we looking for to understand what do these values mean? And why do we have to do them every 3 months? Why do we have to do a CT every 3 months? Things like that. So those are discussion points that, just to make sure hopefully what patients get from me is that I try to explain to them why I'm doing everything I'm doing, and what the alternatives are. And if you don't do this, then we have to do this type of thing. So I try very hard to educate the patient on why we're doing these things, so they don't walk away and like, yeah, she ordered some tests and I don't know why, so I try very hard not to do that.
And that's why people like Larry needs the wife along to remind him why he has to go get that done. Sorry.
No, thank you so much.
Oh, go ahead, Dallas.
No, just want to thank you for sharing that. I think that's something we really wanted to incorporate in future resources that we're developing, especially these diagnostic algorithms, just to equip you with as much information about the different serologies and different diagnostic tests. So for you to make the best decision as a provider and for your patients.